Hello, my name is Dr. Michael Mack. I'm one of the residents here at the University of Calgary, here to explain to you the posterior hyaloid detachment, level 3 in the VRTC levels. In this particular case, your job is to remove the posterior hyaloid and to also do a core vitrectomy. Um, you also have to induce a PVD like I'm doing here. So what you're doing is just using aspiration, no cutting. You want to try to pull the posterior hyaloid face to an appreciable level. That way you're able to start cutting and creating some space. You don't want to pull too far to the periphery. I have tried that before. What happens eventually is that you induce a retinal tear because you have a singular point where you're exerting quite a lot of force. I would recommend going with the wider field lens. There's an option between 90 and 120, and so the 120 helps you see to the ora serrata. In the cases here where I'm close to that of the vitreous base, I generally switch to a very high cut mode. So whatever the highest setting is there, I think it's about 10,000. And I want my aspiration to only be about maybe 150 to 200. So that way the cutter is working without pulling as much. If you pull too much, the system will alert you if you've caused a retinal tear or if there's too much peripheral retinal traction. So you notice here that I'm just trying my best to clean up the vitreous base. It is a little bit harder underneath the light pipe, and you will eventually need to switch hands and try to use the cutter directly on top of the area that you're not able to get right now underneath the light pipe. So Dr. Warrian has taught me about the D concept. Because this patient is phakic, you want to be able to be mindful that you can touch the lens itself. That will cause you to lose points in the simulation if you're reaching too far in one particular area. In this case here, some people will teach you just to stay on the side that your cutter is in and not to reach across directly with your cutter, as that will have a higher risk of touching the posterior capsule. So just take your time in this level. You don't have to shave all the way to the ora serrata. Again, I have tried levels where I've shaved really close. First of all, it takes quite a lot of time. And then the other problem that occurs is that um, you have a higher and higher risk of inducing a retinal tear. Obviously, in the case here, um, it's a little bit easier than in real life. In real life, you can sclerodepress with your light pipe in order to shave the vitreous base as close as you can, but it's not an available option. You can induce sclerodepression, if that helps in the module, but I also found that it didn't necessarily help me to get much more of the vitreous out, and it didn't really change my score. So if you leave a small skirt of vitreous like I have here, generally speaking, that still will allow you to get a relatively good score. So here the area that's most superior is tough because your cutter has a hard time reaching that particular area without inducing too much pressure on the globe. When I do these simulations, I try to be mindful of how my hands are positioned because when you do the core vitrectomy in real life, for those of you who have a chance to do it, it is obviously a dynamic procedure where if you are putting too much pressure on the globe itself, um, you're obviously going to change the corneal or induce corneal striations and change the view, etc. So you don't want to push too hard on the eye. You want to pivot on the Crow card. So we scored 98 in that level. Please like and subscribe for more. Thanks for watching.